Welcome everyone to this presentation by InfoGard Laboratories. Our topic today is the 10 steps to protect my covered entity from breach. This presentation is being given in support of Health IT Week. Your presenters today are myself, Alan Martin, I'm an account manager here, and my colleague Marvin Bird. Before we begin on the 10 steps, I'd like to give you some background information, starting with a brief description of who we are. InfoGard is a test and certification laboratory working in the healthcare, payment systems, and federal sectors throughout the US and internationally. In the healthcare sector, InfoGard works with the ONC Electronic Health Record Program and was the first organization approved by the DEA to test and certify applications for electronic prescription for controlled substances. InfoGard also conducts security risk assessments and audits for meaningful use and HIPAA compliance. The requirement driving our presentation today is the HIPAA security rule. The HIPAA security rule requires that an organization conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the covered entity. This rule is enforced in several ways, but most commonly by the Office for Civil Rights of the Department of Health and Human Services, who are authorized to investigate and to penalize offenders based on neglect of compliance. These days, breaches are very common. As this slide shows, even multiple breaches, and in many cases, the covered entity is not even aware that a breach has happened. But why is this going on? Partly it is due to carelessness or rogue employees, but more often now it is due to criminal activity. A medical record has 50 times the value of a credit card number on the black market. This is because medical records contain detailed personal information that give more opportunity for identity theft, drug and medical insurance theft, and indeed potential for blackmail. Now, without further ado, I'd like to pass you over to Marvin Bird, who will take you through the 10 steps.
Following are 10 steps to help protect your covered entity from a breach. Step 1. Security risk assessment. The first step is to perform a security risk assessment. Knowing what your risks and vulnerabilities are is a first step to protecting yourself. This can be conducted by a trained staff member or by a third-party organization. Here, you put yourself in the position of an attacker. The HIPAA security rule provides a great list of security controls to help mitigate those risks. Here is a bit more detail about the financial liability we discussed earlier from the HITECH Act. The per record cost is dependent on the circumstances of the breach. These circumstances are based on how the breach occurred and the negligence of the breached organization.
That's a great slide, Marvin. This shows how just by addressing and assessing the risks and vulnerabilities alone can reduce liability substantially. Just moving from willful neglect to a violation due to reasonable cause reduces the minimum fine from $10,000 per record to just $1,000 per record.
Step 2. Risk management plan. The next step is to create a risk management plan. In this phase, you will decide which controls need to be implemented to address the identified risks. It is important to assign a schedule and resources to each control. Finally, assign responsibility of each control to the most suited staff member. Step 3. Evaluation. In many cases, organizations will already have controls in place that are mitigating risks or will help mitigate newly identified risks. It is important to ensure that these controls are operating as expected. If, for example, there are motion sensors connected to an alarm and they no longer function, you may not know this unless you test them. Step 4. Train staff. Having staff members that are trained in security might be the best long-term solution to security. Oftentimes, security-minded staff members will identify risks on their own and may even have ideas for effective controls. At a minimum, if staff members are not trained on the responsibilities related to the security controls already in place, and those controls might not provide the expected security. For example, if policy requires annual review of what staff members have what keys, and the facilities manager is unaware of their responsibility, then they may not have any system in place for keeping track of keys. Then we may have identified a new vulnerability that would otherwise not have existed. Step 5. Threats can occur externally or internally. Malware and targeted hacking can both lead to a compromise of EPHI. Fortunately, there are a large variety of tools that can help secure an organization's network and IT infrastructure. Hiring the right IT consultant or third party can also really help make your organization as secure as reasonably possible. Step 6. Contingency planning. Contingency planning is the often overlooked threat to an organization. When a disaster or emergency happens, standard operating procedures can easily break down. When employees are required to think on their feet and providing healthcare has become more critical, employees need to have procedures and training on how to handle these situations, or protecting EPHI can be completely overlooked. Step 7. Monitor access. Monitoring access to PHI is essentially to determine if unauthorized access has occurred. Remember, the lowest tier of liability considers that, quote, by exercising reasonable diligence would not have known that such person violated such provision, end quote, referring to the breach. Monitoring access can be the first and most important step to exercising reasonable diligence. Step 8. Automation. It can often seem the easiest to address threats by writing a procedure for a manual process for employees to follow to mitigate a threat. While this may seem cheaper initially, payroll is often the largest expense to any organization. Implementing automated security controls can quickly be paid off in staff efficiency. Additionally, automated systems take out the human factor, which is often error-prone, and can provide tools for concrete forensic analysis if a breach does occur. Step 9. Business associates. It's true that the Omnibus Rule includes provisions to shift financial liability to the business associate. However, this does not mean that an organization's reputation will remain unaffected or that there will be no financial impact. Being associated with a breach may cause a loss in patient trust and high employee turnover to avoid individual reputations from being affected. A loss in a key business associate unexpectedly may disrupt services for extended periods of time. Proactively ensuring that your business associates are actually HIPAA compliant themselves can avoid indirect financial impact to reputation, and loss in key personnel. Step 10. Mobile devices. Mobile devices represent a key vulnerability in most organizations. Mobile devices should be treated with the same security as any other computer or workstation in the facility, or with higher security, since they are far more likely to be used by unauthorized individuals. For example, misplacing an unencrypted cell phone with emails containing EPHI is a breach in confidentiality. Consider the minimum business need for a mobile device and the costs associated with securing them.
Thanks, Marvin. That concludes our presentation. We welcome any questions on this topic, and we'll be responding to and reposting answers on InfoGard's Health IT blog throughout this week. Send your questions to sra@infogard.com, and as always, remember, there is no U in InfoGard.